Venetian here in beautiful Las Vegas. I'm David Temple, and I'm joined by Todd Ehrlich, Bob Conte, Mike Skramstad, and Doug Schulz. And let's get right to, first of all, let's do this. What did you think about the morning revelation? Let's start there.
You mean the combination of two of the greatest dental companies in the world?
Yeah, let's start
Something
there.
like that?
Yeah.
Just phenomenal. And what I think is really going to be good for us as clinicians is that it adds resources to advance clinical care. And being high-tech dentists that we are, we just thrive over that. It's going to be awesome to see how the technology advances exponentially.
Yeah.
I think it's great that these two very classy companies, both promoting very high-end products, quality products, are, going to, like Todd said, combine their resources, and really for the betterment of all of us. It's going to be awesome.
Yeah.
Psyched.
Along those same lines, I agree. I think that whenever you can combine resources, it's going to be better for the clinician, which will be better for the patients. So I'm excited to see what they come up with as a join forces now.
Why don't we just jump right into the CEREC 4.4 Sirona Remote, because that's really what this panel is all about.
When I first got it, I was thinking, well, this is kind of it's okay, but it grew on me. And now what I find is, even on the easiest cases, I can just get up, walk into my own office, drink the coffee, and I can be in my own little environment, and I can look at it on a 27, 28-inch monitor and see my emails coming up, and I can check this over here. I can get all done. So what it does for me is it reduces the stress of working in front of a patient directly. Not that it's not fun, it's just more fun to be in my office.
And we all have those patients that we really don't want to do something in front of them. So that really opens up the door to, okay, I'm going to step away. But then we also have the patient who really wants to see what's going on. So you put the iPad in front of them. Yeah. And now they get to be involved with the whole design process.
When I first got it, the main thing that I was interested in was ergonomics. Because it's very difficult sometimes to be scanning a patient and then looking backwards at the machine. So to be able to sync up that image, either to a chairside monitor or to an iPad, it's been amazing. You can look right at it, and I, like Todd, I wasn't quite sure what to think when I first got it, but it grew on me fairly quickly.
Mike, the place that I really think it's the best is when you're doing multiple units, or you're doing something that's going to take more brain power, because when you're in your office and you can focus just on it, you can shut the door, you can be quiet. Or it frees up the system as well. So your assistant could be doing something on a remote desktop. You could be on the CEREC machine as well. So it gives you a lot of freedoms within the office that I didn't even expect until I started using it.
Right. And what else you can do is every now and then when my partner's on the CEREC machine and I'm sitting in my office, I'll kind of log in and just kind of mess with his stuff a little bit.
Yeah.
His model and go to the mill face, and he thinks the machine's possessed and he doesn't know what's going on. Then he sees on the bottom Mike Skramstad is logged in remotely on his iPad.
That's why.
So.
Great Scrammy.
But to that end, we have a busy practice, 2-doctor practice, and we are constantly moving that machine, wheeling the Omnicam from room to room to room to room. So it's kind of nice to be able to get up and go, like Todd mentioned.
Todd, it also opens up the doors to a training center. So, when you're doing something live, you can now put these on all the remote stations. So you can do one acquisition, and now 20 dentists can be looking at it. And it works so fast.
Yeah.
That's what's amazing.
Never thought of that. That's awesome.
I did a veneer case just a couple weeks ago, and I was using the remote, and my monitor is big enough that I could slide the CEREC screen over, and then I had all of the pictures of the case. And so seeing it in 3-dimensional off the software, and then also within my photo programs, it really added another dimension on when I was designing the veneers. It was awesome.
Let's talk about the BioJaw. Okay. Who wants to jump on that one?
Basically, I thought James Klim did an excellent job showing the real power of BioJaw in his presentation today, which I feel is the interiors. It's the digital wax up. It allows you to very quickly and easily manipulate something into a better proposal. And plus, the BioJaw, just the initial proposals that people are going to see on posterior teeth from the new algorithm of BioJaw really is going to make it great, specifically for the new user, because there's so much less work to do in the software.
Very few adjustments with the new software. It's
a cool application of BioJaw seems to be like when you're doing a quadrant of implants. and you really have no teeth to relate to. So BioJaw allows you to rapidly propose some teeth that fit into the occlusal scheme.
You know, as testers that we've been all these years, we've always wanted some sort of aesthetic templates. You know, like, hey, I want more of an ovoid or shape, kind of the whole denture scheme. And now we have that with the BioJaw function. We select, hey, this is a rounded face, I need rounded teeth. And it goes down to our core DNA of how we were trained as dentists. Wow. You know, it just seems like, you know, it's coming so full circle that I can't imagine it doing it analog ever again.
Yeah, and the other thing that BioJaw did was it opened up the possibilities with different global tools. Just something very simple like biogeneric variation, a tool that was probably not very commonly used in the past because it would almost distort a proposal. Now you can use this, and whatever you choose, it stays. It really has opened up a lot.
I like the fact that it's got handlebars.
Yeah,
you know,
right.
you just get it right on that incisal ledge, move it left and right, and it makes it proportional very quick.
You have the ability to link things and do things and rotate things and not just do a single tooth and a single tooth and do 2 or 4 or 6 and see the same movements and center your midlines. And you did a great job yesterday, Scrammy, on demonstrating that.
Yeah,
so.
it's going to be a wonderful tool.
What else? What else has been impressing you since we launched this thing just hours ago?
Well, I got to tell you, 4.4. You know, every update Sirona's ever done has been geared towards the new user. You know, making it more simple, making it more streamlined. As experienced users, there are things that we've always asked for that we never quite got because it would make the software just so complex. So there's a fine balance between, you know, getting everything we want and having just enough so the new user's not overwhelmed. And this software does a nice job balancing that out. For example, we've been crying about having our favorite materials on the very first screen that it opens up. It makes so much sense to have that there.
Sure.
But for a new user, he would get lost. He'd get lost trying to figure out materials. So now it's just there. Just simple stuff.
Yeah,
what do you guys think of the way the windows can all be placed within the screen? Because at first I didn't like it. It was so different.
I remember.
I was not happy with the new look of it. And now I can't believe how my brain has changed because I put them right where I want them to go, and it's linear. So I just pull it down and click the button that I need, and it goes right back up.
And it always it remembers where you're at.
Yeah, that's right.
As well.
Yeah, that feature of staying and locking it in place for the next case and the next case is great.
Another really neat feature that I think 4.4 gives us is customization of our parameters. So when we're, whether we're doing, let's say, Celtra Duo or Emax or whatever materials, we can set up individual parameters for that material, or for a multi-doctor office, it could be Dr. A, Dr. B, and all of those parameters are set, and those little things are what we like so much for overall fit and predictability.
Yeah, flow from left to right, and you know, kind of yesterday, are we going to go broad or are we going to go deep? It goes deep very quickly. Click, click, click.
Yeah.
All right, we got about 60 seconds, so why don't we do a little quick wrap up? We've got to move people in and out. So last comments on 4.4, or anything, actually, for that matter, for this entire convention.
The one thing I can say about 4.4 is the overall platform is just unbelievable stable. The imaging is easy. The models are phenomenal.
Again, it's not a revolutionary change like 4.0 was, but I think most users are going to find they're going to like it very much.
Yeah, and one thing we haven't mentioned is CEREC Guide 2, which I think is probably the biggest home run of the whole entire software. It's unbelievably amazing, and the best thing about it is it's so easy to do. I could teach somebody that's never used CEREC or never used how to design one in 5 minutes.
Wow,
it's a home run.
The user platform, just intuitive. Now it's don't think, just move.
Last question. Who's going to be running the Big Hair 5.0?
I've got that.
The 5K. You?
I've got that. It's one of the greatest events Sirona ever put on. At 27 and a half, there were hundreds of us running up and down the strip.
Yeah,
nice.
Not me.
I've got
a 5K. Get up early. Don't drink too much.
I've got an 8-week-old baby. I value my sleep.
Yes.
I will be sleeping.
I'll watch it.
Guys, thank you so much for coming by, and make yourself at home. We're going to take another short break, and we'll be back live here at CEREC 11:30 live in the Venetian and the Palazzo in Las Vegas, where we hope you'll stay with us all day long.